As we've been doing really since the board had its first meeting, we've been trying to update on the very high priority that NHS England gives to active transparency, as David said earlier, but equally to the genuine, authentic commitment to public and patient participation that we have. So this paper brings together a particular focus on ways in which we are trying to engage the public very, very meaningfully in the planning and decision-making process of NHS England from now. And just to break that down into three parts to summarise bring out some of the points in the paper, we start with the Citizens' Assembly, which was a commitment we made right at the beginning, the idea that we absolutely recognise the importance of us as an organisation being properly held to account for the decisions we make. And we've tried to do this in a very different way, so that rather than having a view, going and testing it and then setting up some sort of organisation, what we've actually done is we've engaged, I think, really meaningfully with quite literally hundreds of different advocate voices, individuals, organisations, to try and think differently about what this challenge could look like. So we emerged from the most recent couple of days where we were joined by 450 colleagues from across the sort of patient and citizen spectrum to help us think through what the answer might be. And we spent 2 days together just reflecting on how participation can be made real. And just to give you some highlights as in the paper, I was amazed. I think it's just the most fantastic evidence of the willingness of people out there to really work with us on developing a kind of communal future. But to give you a sense of this, the event generated 7 million Twitter impressions, which is just amazing. That's a real conversation on social media about the future for NHS participation. The event was live streamed for 2 days, and it was a genuinely engaging event. And in total, we had on average around 700 people watching that at any one time, which I think is again just amazing. So first of all, to thank all those people that participated, but just to say that we are, I think, making really good progress along that journey towards a concept of an assembly, a network that will bring patient voice right into the heart of NHS England. And I'm going to be picking up with Olivia Butterworth, who is largely responsible for arranging the event, with Victor and Kieran on taking that forward with an expectation that we'll be launching something at the Expo that will make real this commitment to participation. So that's one thing just to highlight to the board. The second thing to highlight to the board in relation to this, in a way, campaign to try and make the social movement in healthcare real was the Future of Healthcare conference, which I know a number of you went to. I unfortunately wasn't able to get there, but Martin McShane, our colleague, did such a fantastic job in a way, advertising again the commitment we've got to participation. And that event, which we was organised jointly with UCL in London, brought together a people's panel of 14 voices from across the community of the NHS, who I think spoke extraordinarily eloquently about the challenges they face and how we can support them in improvement. And there were just two things which I thought would be worth reflecting on. One was a really extraordinary article written by Jackie Ashley, Andrew Marr's wife, reflecting on her own experience as a carer, and really thanking NHS England for, well, in her words, all credit must go to NHS England for its bravery in hosting this event. It was a very open discussion about the challenges real people are facing, and her view was that at last patients are being given the chance to be properly heard in the design and commissioning of services. So that was one voice. I was subsequently actually emailed by a GP from Austria who had happened to go to the event and said he was so, his words, I was so amazed with the degree to which the NHS is trying to involve patients of the public. Are there lessons that I can take home? Just a small symptomatic example of something I think we're on the cusp of making really great. So that was just another example, which I think was a very important one. And then the third thing I just wanted to highlight in this paper was the publication of Transforming Participation Guidance, which colleagues in my team put together very closely with CCG colleagues and others in area teams and so on, and in the broader public and patient community, to think really hard about the kind of standard we expect commissioners to reach in making participation real. And just some of the, I think, very important commitments we've now made, which we will be following through to deliver, include, for example, really championing the commissioning of proper personalised care planning. As you'll know, care planning is a fundamentally important part of delivering properly personalised services, particularly to people with long-term conditions. There is an existing commitment that people with those conditions have a right to a care plan. Unfortunately, in many cases, those care plans are not what you or I would think of as a properly personalised attention to detail for the individual. So we're going to introduce a standard which will involve some degree of digital, an interactive component, allowing people to share conversations when they wish to with their clinician. And it's an important commitment for us that we do now become quite intolerant, really, of GPs in particular and others who don't take that responsibility seriously. So supporting them with ways in which we can make care planning a reality for everybody who has a long-term condition. Equally important is our conversations that we've had with local commissioners, particularly CCG colleagues, who are really anxious to engage with this agenda, but finding it difficult to know quite what to do, and seeking support really in learning what sorts of techniques and methods might be deployed to both do things like listen harder, just market research, or indeed modern techniques of engagement, understand more about how social media, for example, could help them do their work better. So we're going to be launching a package of support for commissioners, focused very much on helping them do the very best they can around participation. We've launched a health literacy programme, which I'm hoping I can brief the board on later, a commitment to bring 100,000 people in the most disadvantaged circumstances to understand more about how they can use the internet to search, to take greater control of their own health. And I should say already that campaign has been started, and already nearly 50,000 people have signed up to going through the programme of e-learning and so on. It's just an amazing phenomenon. I'm going to come back and talk about that in a bit more detail. So just some highlights from the participation guidance, which I hope in our planning guidance and in our own business plan we can really get behind. I think it's a really important legacy opportunity for NHS England to promote. And very finally, we have the annual general meeting. Of course, we were all there. I think a very good example of us really trying hard to live our values. As far as I know, unprecedented. I'm unaware of any other board in the public service at all that has been so committed to holding an AGM in such a public context. As you know, there were 200 people who joined us in morning sessions to think through some of the challenges we should be facing and tackling. 400 people came to the actual AGM itself. We had that incredibly moving and I think robust conversation with some of the work stream leads on the platform there. Again, just as an indicator, more than 200 Twitter accounts were reached during the course of that day. That's a lot. That's more than the independent newspaper sell, or way more than the Guardian sell, for example. This is properly reaching out to the public at large. And what we've committed to, again, in the paper, is that we will be taking feedback from the 5 themes that we looked at during the course of that day to the Expo on March the 3rd. So this is an ongoing real commitment to taking action. So not just listening for listening's sake, but getting on and actually doing what we're hearing. Just some highlights then of the work we're doing in participation. I think however bleak the times might be, these are things that we should be very proud of. They are just beginnings, but they're real beginnings. And what I think I'm most excited by is the way in which the community at large is responding so positively to our request really for help. And I think that's something we should be very positive about.
Well, thank you, Tim. I think you know that you have the full support of all the board on this. I mean, it only works if all the board buy into it and don't see simply listening to the public voice as a listening exercise, but actually as a prompt to action. And of those events that you have discussed in your paper and orally this morning, I must say those that I've participated in I have found exceptionally transformative in my understanding of why we sometimes have a mismatch between what providers think that patients want and what patients say that they want, and especially vividly, I think, in relation to long-term conditions. But thank you for those comments. Let me invite observations from around the table. I have Victor and Margaret and Jane.
Myself and Kieran are we're involved in the design of the Citizens' Assembly, and I just wanted to make the point that I'm very ambitious about this process, and that there are 2 ways in which these things can go, in my view. One is that we can get people involved. I think that's fairly easy, actually. The Twitter and that stuff is fairly straightforward, and there's enough people out there who want to engage. The really difficult bit is actually engaging the people who are outside the IT loop and bringing them in, and outside the normal discourse and bringing those in. and that's difficult. The really difficult bit is actually how we use this citizens' assembly, NHS assembly stuff to change behaviours in the NHS, which is about power. So the ambition should be not just to engage people, but to shift power from where it is to where it needs to be. And what I'm interested in, and it's part of the discussion that we're going to be having next Tuesday, is what are the indicators that is actually happening? Yeah. Because I think we could fool ourselves into thinking that it's real when it isn't. And which leads me to my second point, which is about the idea of the participation of individuals in the design of services. And I think it maps onto the point that David was making earlier. It strikes me that perhaps we're not being ambitious enough. And the reason why I say that is that actually out there are lots of really clear methodologies for engaging communities that are reliable, repeatable, and are happening. And it'd be a shame for us to reinvent the wheel, to make the same mistakes other systems have done, which is to think that it's not happening and then to reinvent something. I think we should be learning and promoting what works and that is out there already. And secondly, I think we should go beyond simply the idea of care planning. I think that care planning and the idea of people having a right to a care plan is fantastic. Yeah. But really, the big shift is the co-design of services that people are involved in delivering, which again is happening out there. But in order to do that, it requires quite a significant power shift. So I think we just need to be clear about the implications of what we've started, how we really understand the shift, the needle of power, because that's what it's about, and how we overcome some of the obvious barriers that are in place to preventing us from doing that. In other words, we have a real discussion about it and not one that is actually an artefact. So I think Tim's leadership on this is fantastic, but I think we have to push the power thing, because that's where tyres hit tarmac.
Yeah. And I think my points are very similar to Victor's and probably will be much less well put. I mean, essentially, well, first of all, I really do want to congratulate you, Tim, and the team, because I actually think that the digital revolution is really taking off. It's really exciting. But what's great is also that you're running that in parallel with the assemblies, the panels, and so that it's very clear that it's not just those who can enter the electronic age can speak to us and speak to the NHS, which is critical. There will, of course, then still be people outside of that, and it goes back to Victor's very earliest point, and we need to make sure that there's proper investment in making sure that they aren't left behind. But what my primary point is really, I think, allied to Victor's point about shifting the power base, what I think would be really helpful would be to be able to give back to those who are responding to us information about how the responses are being dealt with, so that in effect it really does become a dialogue, so that it's to use the phrase that of one of the attendees at the AGM used, which I think really summed it up very well. It's, we said, you did. So that it's very, very clear that we are responding, the system is responding, because otherwise that we're all talking about nothing in particular.
Kieran.
Just add one other dimension. I think the Future of Health conference was a fantastic example of patient engagement and the clinical engagement and the system engagement at the same time in the same room. And I think where we get that right, we'll have much more sustainable solutions. And I just have this slight worry that we'll do some fantastic stuff over here with the Citizens' Assembly. The commissioning assembly will be in a different room on a different day, also doing some brilliant stuff, and they won't necessarily gel. So there's something in this about bringing all of that together in the right way through the call to action process. So we don't end up with two fantastic engagement processes, but they don't quite align, and they don't quite capitalise on the contention that you get when you have the different points of view. Because there are some people out there saying, one of the Royal Colleges saying, what we need is less engagement and more decision making, and presumably by members of that Royal College. And so there are forces of resistance out there in that sense who don't quite see the need to do this. But it's fantastic.
Yeah, no, that's right.
Thank you. David?
I mean, I think Tim said at one point during his presentation the tough times for the NHS, and they are, and people are under pressure, and there are great challenges and all the rest of it. But what strikes me about the sort of things that Tim's been talking about, and it kind of reflected to me over the last week or so, because I've been to two things. I've been to a values summit. The NHS England have been sponsoring a series of values summits around the country. We had 400 people at the one in London. I also did the one in Manchester. And there's huge energy for people want to engage in this and change. There's undoubtedly, the NHS is not all about inspections and all of that and regulation. There's a huge amount of energy amongst the people who both use the NHS and the people who work in it to make a difference in the future. And we had the launch of NHS Change Day earlier this week as well, which was a massive bottom-up attempt by, first of all, a small group of clinicians, but now has expanded across, nearly 190,000 people pledged to change last time, and the plan is to this year to generate 500,000 of these. And there's huge energy from frontline staff and people to make things happen and make change happen. And these sorts of things that Tim's talking about help and encourage this in a really kind of a fantastic way. So I think we should be really positive and get behind all of this, because this is the future of the NHS. We're not going to change the quality and the outcomes of patients and the power relations by systems and processes. We're going to change it by inspiring and motivating people to get engaged and taking that power. And I can't kind of reinforce that. And this is a really kind of positive thing. But on the other side, Tim, just when you originally pitched the idea of a citizens' assembly, you said it could be led by people like Cheryl Cole, and I just wonder whether you'd invite her to join and whether she'd responded to that invitation.
Yeah. So, well, the answer is we haven't yet engaged with Cheryl on the process. But actually, no. I mean, but we're heading towards a really meaningful thought about how we can develop, how we can kind of crystallise some of the voices that the community has, some of the views they have, and we'll have to see whether she's interested in due course. But if I could just very quickly respond to a couple of points which were made, I think that. Whilst I've been advocating it ever since I started and before, that unleashing the power of people is the long-term solution to the sustainability of the health service, however way you describe that. And I believe we are absolutely on the tipping point of a movement genuinely starting, people feeling empowered enough to start speaking up, to hold their local commissioner to account. We've got Healthwatch, all sorts of other networks that just amplify that opportunity. So one thing I wanted to say is in no way is anything we're doing trying to reproduce what other people have already done. There is a fantastically rich community of voices of advocacy that exists in the NHS, and to be honest, and health and care, properly. And to be honest, we haven't made enough use of that network, of those many networks. So one of the really important things about this is not duplicating or sort of monopolising in any way at all. It's absolutely about building on the networks that exist out there already, and to inform us as commissioners. But I think it is really important, and it's a big challenge for us, that we do recognise that in order to, in a way, persuade our own folk of the importance of this, as they struggle with all those very real challenges just about getting things done, that we do crystallise these commitments in ways that are measurable. And I think it's very, very important that in the context of the process around the planning guidance and our own business plan, that we do come up with some reasonably hard-edged measures that try and capture how we can hold ourselves to account for doing this properly. And I think that's an important commitment we should make.
Well, thank you very much, Tim, and to echo the views of other members of the board. I mean, the sort of classical model of public participation always was that it was a time of furious activity and public voices were listened to, but then it stopped. The voices were listened to, taken into a plan, and then the plan led everything. What's so different about this is the time element. This is the beginning of a continuing process, not a one-off. And I think one is very taken now by listening to not only the voice of patients, but also the responses we're starting to hear from the commissioning community of how they adapt changing patterns of care to changing preferences and priorities of patients. So thank you for your work on that. You have, I think, a presentation for us now.
Yes, so in fact, in a very related way, what we again, right at the beginning, we wanted to offer people the opportunity to be part of the commissioning family, to actually offer up feedback and comment on the quality and of local services, so that those service providers could fix the problem, could address themselves to the issue as quickly as possible. And in a way, it seems strange this isn't already out there, given the existence of the internet, very low-cost technology. Very large, parts of our community are very involved, as we've just learned, with Twitter and social media. So really making use as far as we can of the willingness people have to engage in the online world. So what we've got, Care Connect, I think, could turn out to be one of the very important innovations that we have initiated, and the idea is to provide a multi-channel point of access. You can ring it, you can tweet it, you can email it, to give people the maximum opportunity to just engage with comments about their local services, finding out more about them, certainly not just to criticise. In fact, most of the comments that we get are not critical comments, they're very positive comments, but it is also a means by which a local hospital or a local GP practice in due course can properly engage with their local communities and have a real-time conversation of the sort that we're used to in so many other parts of our lives. And we talked about this briefly at the last board meeting, and I was just going to quickly show you what is currently a pilot. So this is only currently available to people who are engaging with 17 hospitals in London and 3 in the North East. But we've been working with a variety of colleagues across the health and care system, particularly regulators of complaints like the Ombudsman and the GMC, to investigate whether or not this could be a sort of front door for them as well, whether we can help streamline the process by which people who want to make an actual complaint as well as a comment can do so much more easily than is currently the case. So I'm just going to quickly show you how this works. And this is actually accessible through NHS Choices, the health and information service that it obviously already exists. And you can see that there are sort of 3 core offers. Just share your experience with other patients, rather like TripAdvisor, just free text comment. Actually offering people the chance to find out more about local services. And one day, Barbara and I hope that this will become an integral part of 111, which can offer these sorts of opportunities as well. And report a problem, which is the bit that I'm going to show you today, which is really encouraging people to be upfront with us about services when they're not going brilliantly well. What we know from Francis and from Don Berwick's report is that if you capture the small things, the indignities of failures in basic customer service, that's how you can turn things around before they start going really wrong. So this really is about encouraging people to just tell us the small things. The room was hot or cold and so on, or things on that sort of level. So if we just go through to, I'm actually going to put in. Obviously it's been it is live, but it's been pre-checked it because. So this is a problem number, which I'm just going to put in here. So you've made your problem, and I'll show you how you can do that. You've given your comment. This is one that exists. There's a real one, but I'm just going to go straight to it. So here in St Helier, somebody has complained, I think, about quite a serious issue in relation to the treatment of their mother. I don't know if you can see that clearly, but this... Can you sort of see that just quickly? So this is really about the way in which the mother was treated and clinically inappropriately, even according to the lead clinician in the ward subsequently. And this is the daughter, I think, writing in, expressing her anxiety about the quality of care her mother was receiving. The good news is that very, very quickly the hospital gets on the case. So the idea of this, of course, is that it's real time. The hospital can then see the comment, and as you can see beneath that, acted quickly to engage with the lady making the comment, and then met with them and obviously got to a point of resolution. And so that's now become that's been closed as a complaint, but is still visible and will remain visible forever on the service. Now, if those complaints can also be are also presented on a map, and this is really the key part of the power of this, because the way most people would look at this, by going into their local provider and observing how many problems are on the map at any one time, and the actual colours change. So if you were to scroll out, widen the geography, you could see in your local area hotspots where you had large numbers or numbers of active complaints, and we believe this will become a very important tool for local commissioners in managing in real time the actual quality of their local services. And obviously at the moment we have a relatively small number of active comments because we haven't promoted it. But you can just begin to see how the future could start to look. This is a technique, by the way, that's used in most American cities to improve the quality of their local services. So if you could just imagine in this map of London, you had hotspots and so on. These are all closed complaints that have come in comments around the NHS. The other important thing here is that we've also now built into this a link to the friends and family test. So in due course, providers might choose to encourage people to comment over Care Connect and also link directly to the friends and family test score that their hospital is being given by local customers or local patients. So this is, I think, a glimpse of the future. It's very early days, but I just wanted to give the board a chance to see it.
That's great. Thank you. How do people access it?
So if you're in one of the pilot areas, there's you're actively individually offered the opportunity of engaging. You actually just access it online. It's free. I mean, anyone can see it. It's just off the NHS Choices website as things stand. I might just add actually on that the popularity of this kind of opportunity is demonstrated by another fact, which is that NHS Choices recently recorded a new level of the volume of people using it. And so today, more than 1 million people each day are accessing NHS Choices for all sorts of different purposes. By far the largest health information resource of its type anywhere in the world. So I think that this, I'm sure that when we launch this nationally, as we propose to do during the course of next year, that we will find people embracing it and hopefully engaging quite fully with it.
Can I just kind of I'm talking to some chief executives of hospitals who are now online with all of this, and it does fundamentally challenge and change the way they do their job. And they say that in the sense, for the first time, they can literally have on their screen in real time a whole set of responses from patients about issues. They can operationally engage and involve things in a way that they simply didn't in the past. And it just challenged the way they run their hospitals in a really productive way. So I think this is a really, really big lever for change
So it empowers leadership and management within the institutions. Great. Okay. Right. Thank you very much, Tim, and please pass on our thanks to your team for the innovative nature of the work.